So, Crystal, you're a nurse in the COVID ICU at a local hospital, and you've been helping to care for coronavirus patients. Talk with us about that. What is it like?
Sure, yes. Thanks for having me. I've been working in the ICU for about 12 years, and we haven't seen anything like this pandemic that we're facing. It is a bit different. It seems like every time I go to work, there's a new policy or something new that we're doing. I think some of the main differences is, like Terry was saying, the families aren't able to be with their loved ones at the bedside. So we are definitely, as nurses, serving as a bridge between the loved ones that are calling to check up on the sick patients. We go in the room, we do as much care as we can because it takes at least probably 2 minutes to dress up in all of our PPE to go into the room. We talk to the patients, we comfort them, and communication with between us and the patients is a bit harder because we have a mask on. We have to talk louder. They sometimes have a lot of oxygen connected to them, so they can't hear us talking. So it seems like we're shouting at each other, but we're not. So yeah, things are a bit different, definitely.
Yeah, so I mean, working so closely with, patients who are impacted by this virus, do you feel safe? What is it, what is it like to go there every day? And
Going there every day, I do feel safe because our hospital has provided us with N95 masks, with
Mhm.
a Draeger mask. We also have this something called a PAPR, which is like a personal air purifying machine that we can wear when we go into the COVID patients' rooms. So I feel
Now,
safe.
I think we have a picture of that. So let's see it as you're telling us. Let's see what that looks like. Let's
Yes.
see if we can see it. So you were saying, okay, tell us what's there.
So
Wow.
this is called a PAPR. So it kind of looks like a spacesuit. That hose that you see is attached to a fanny pack that
Mhm.
filters the air. And that mask I'm wearing there, that's called a Draeger. So it filters out almost 100% of the particles in the air.
Wow. So you get suited up, and do you have to
Yep.
change all of that every time you see a new patient, or you wear it for the
So
whole?
the mask that I had on that was purple, we wear that throughout our shift. We can take it off when we go to the break room and we eat and drink, but otherwise we're wearing that. And then the spacesuit we put on whenever we go inside the patient's room. And then we exit, we wipe it all off. We wipe the hood off, we wipe the tubing off, so it's clean for the next time we have to go in.
Wow. So you were mentioning that you are there with patients and, family members can't be there. And so sometimes you're there. Tell us about a patient you've cared for and your experience with them.
Sure. So there was this one patient that really stuck out because he was dying. He was older and he had other comorbidities, and the family decided not to pursue any more heroic measures. So, of course, they couldn't be with him as he passed. So we actually used technology. We can use Zoom or FaceTime, and we have an iPad on the unit. So we
Mhm.
brought the iPad into the room. We called the daughter, and she was able to FaceTime with her dad as he was
Yeah.
passing. And I stayed in the room as he was taking his last breath, and I had the
Mhm.
iPad up to him so that she could say goodbye. And I was glad that I was able to do that for the family.
You were glad. I mean, I know it probably does your heart good to help them, but boy, what a sad experience
Yeah,
that you had to go through.
it was heartbreaking.
How do you get through your days like that?
It's hard, but the nurses that I work with, the doctors, the respiratory therapists, we are all one great team. We actually functioned well before this pandemic, and I feel like we're functioning even better. We're always trying to help each other out. Whenever we take a break in the break room, we just kind of decompress. We talk about the patients that have really tugged at our heartstrings. We share stories. So just talking about it with other people that understand how we feel, that really helps us through the shifts.